Welcome to Medicap's PDS Express. In today's class, we'll be seeing this interesting question which was asked in the year 2023. So this was a kind of clinical question. Question says that an 8-year-old male child reported with brownish discoloration of the teeth. He had a history of trauma a few years back. No hereditary history is elicited. That means the siblings of this child, they are normal. They don't have any discoloration on their teeth. And again, that will rule out the other diagnosis. So you need to keep this in mind. Now they're asking about the diagnosis. Options given were Amelogenesis Imperfecta, Tetracycline Toxicity, Dentin Dysplasia, or Turner's Hypoplasia.
Hello everyone. So are you a NEET MDS aspirant and you are struggling to find all previous year authentic question? What if I tell you that you will get everything in just one book? My book is out on Amazon and Flipkart. Just check the video for description. It contains all the solutions along with the reason to rule out for your convenience. Get your hands on it today itself and take a significant step towards your success.
Now, the condition which is given in the question, that is your Turner's hypoplasia. Now, what all are the points which favors the Turner's hypoplasia? So, first of all, discoloration, localized, history of trauma, siblings, they are normal, no hereditary history is there. So, the probable diagnosis would be Turner's hypoplasia. So, this is the Turner's hypoplasia involving the single jaw. This is the Turner's hypoplasia involving the multiple teeth. Here you can see. So basically, when the teeth, they are developing, especially in the children, what is happening? The apex is open, and if any trauma is there, what will happen? Localized disruption of the development will take place, and that will eventually lead to the discoloration of the tooth. It basically affects the localized area involving the single tooth, or you can say localized section would be involved. Now, when I say Amelogenesis Imperfecta, so you would have read in your oral pathology as well as oral medicine why this Amelogenesis Imperfecta is caused. So first of all, there could be hypocalcified, hypomineralized, or hypomaturative. Three kind of amelogenesis imperfecta is that either the cells, they are not developing properly, that's why it is taking place. Either the cell has formed properly, the globules, they are formed during the development stage, but they're not calcifying properly, or they're not maturing properly. So that will be, you can say, amelogenesis imperfecta. Again, brownish discoloration would be there. Teeth will be having pitted appearance depending upon which type of amelogenesis imperfecta it is. And you can say teeth would be brittle. The size would be small. It could affect, you can say, primary dentition as well as your permanent dentition. Similar is the case with dentinogenesis imperfecta. So this is dentinogenesis imperfecta. This is amelogenesis imperfecta. Again, in dentinogenesis, the same thing would be happening in dentine, and dentine is malformed, right? So you can say open contact areas would be there, teeth would be comparatively small, root will also be affected. All these things would be there. And most importantly, siblings would also be having the same pattern in case if it is hereditary. So these are the things which will rule out amelogenesis as well as dentinogenesis imperfecta. Now, when we talk about tetracycline stays, like here you can see. So it is said that if a person, like pregnant female, if they are taking tetracycline antibiotic during their gestation period, what will happen? The teeth, they are developing in the fetus, like tooth bud would be forming. So basically what happens, it will lead to the discoloration of the tooth. And if a child is taking during the early years, or you can say early childhood, so the permanent teeth would also be affected. So that is the case in tetracycline stays. So there would be a history of, you can say, drug ingestion. Since nothing was there, our probable diagnosis would be Turner's hypoplasia.